The president of AB Science USA, which he specializes in internal medicine and oncology. His undergraduate degree is from Washington University in St. Louis. He has a degree in veterinary medicine from Tufts University School of Veterinary Medicine. His internship was at Animal Medical Center in New York City, and his residency was at Tufts University School of Veterinary Medicine, Foster Hospital. Today he'll be speaking on the flu virus, H1N1 versus H1N1 or swine flu. Fact or fiction?
Thank you, Leslie, for the introduction. The goal of my presentation is to share more information with you. Certainly, I've learned a great deal this afternoon from all of our speakers, from Dr. Rowe through Dr. Lee. In fact, I'm going to remember to brush my teeth. Thank you. And I'm kind of disappointed. I thought that using the low-sodium soy sauce would be beneficial, but I may have to cut back more on my salt intake. So I think that the speakers have done a great job, and my objective this afternoon is to talk about this disease that the media has really been talking a lot about. This is called swine flu. By way of introduction, probably whether you watch KBS News or whether you watch NBC or if you're looking on MSNBC on the internet, you'll see that this whole thing about swine flu is in all of the media outlets. You can't hide from it. The purpose of my presentation is to give you facts, okay, what we do know about swine flu, so that as consumers, you can be educated about this disease and you can take steps to protect yourself and your family. This presentation, however, is not meant to take the place of talking to your primary care physician. It's only meant to give you background information. Some of the slides were corrupted when they were emailed, so I apologize for some of the collapsing of the slides here. But the full name of swine flu is actually influenza A, H1N1. And what this means is that this particular virus actually contains genetic material from 3 different animals. It contains genes from Asian pigs, birds, and man. So I put those examples right down there. The scientists in this group would be interested to know that this is basically a quadruple reassortant virus. That means that the genes or the genetic material from these 3 different species came together to make this virus, and it has now been confirmed in 182 countries around the world. So as of last week, it's been reported and confirmed in 182 countries. For those of you who are looking to run away from H1N1, may I suggest that you start booking your tickets for either the US Virgin Islands or North Korea. So those are the only 2 places where it hasn't been reported yet. I have a picture of what H1N1 looks like. This is actually a scanning electron microscope image of the virus down in this lower corner here. In April of this year, the World Health Organization officially named this virus influenza A, H1N1. For those of you who would like to know what that code means, the H represents a protein. It's a type of protein that's on the surface of a virus. and that protein is called hemagglutinin. The A letter, represents a protein on the virus that stands for neuraminidase. So most of the viruses that we know that are capable of causing influenza to people will have an H and an A designation. And so this particular one here has an H1N1 designation. It's a fairly common virus, and many of you may be aware that over the past several years, scientists have been closely watching another related virus called H5N1. This is the avian influenza virus that they've been watching very closely. And so you can see that I have H5N1 listed down here. But the purpose of today's presentation is to focus on H1N1, or influenza A. The symptoms of the H1N1 virus are very similar to the regular seasonal flu. So you see these signs here: fever, cough, sore throat, runny or stuffy nose, headache, chills, fatigue, and in some cases you may see signs of vomiting or diarrhea. So the bottom line is, it's very hard to know whether you have H1N1. You have to go see your doctor, who can do a test to confirm if that's what you have. This is another image of the H1N1 virus using special stains here. I think that what's important for patients or people to know about H1N1 is, who are the people that are at high risk? And so what I've done is I've put some factors here of people who would be at high risk. If you are concerned about this H1N1, children who are less than 5 years old, adults who are 65 years of age and older, pregnant women, and people who have a history of chronic lung disease, asthma, heart disease, endocrine disease such as diabetes, liver disorders, metabolic disorders, immunodeficiency, and people who are long-term patients on aspirin. These are people that are at greater risk of developing complications if they become infected with H1N1 virus. So again, as I've said earlier, you should always consult with your primary care physician if you start to feel sick, because they will be able to guide you, and they know your medical history. So they'll be able to guide you on how best to treat yourself. If you start to develop these signs that I have on this chart here, then you need to seek immediate medical attention. So these signs in children would be rapid breathing, trouble breathing, bluish colored skin, not drinking any fluids or not drinking enough fluids, not waking up or not interacting, someone who is highly irritable. So if you have a child and that child cannot be calmed down, they are crying uncontrollably, and no amount of hugging them, no amount of comforting them can calm them down, that could be a warning sign. Developing a rash with a high fever. And then the last one here is symptoms that seem to improve, and then they return with a fever and a worse cough. So if you see any of these signs here, you should immediately seek medical attention and always consult your physician.